You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events. To support programs like this, please consider a tax-deductible donation at wisi.org/donate or by texting WISI to 44321.
So we'll see if you say cool at the end.
I also saw the one and I was like, okay, this is interesting. You know that like if negotiations are done, yeah. Evers definitely dropped the votes to Southern. So but Jesse took that one about
Well, good morning, everybody.
Imagine waking up in pain, and we're not just talking about physical pain, but the anxiety that comes with not knowing what a trip to the hospital might cost. For too many Wisconsinites, that fear is real, and for many, it's enough to keep them home, hoping things get better on their own. But the longer they wait, the worse it gets. That's why we're introducing this bill, to make hospital pricing transparent and upfront. Our proposal requires hospitals to clearly publish prices for common shoppable procedures. We're talking about things like x-rays and MRIs, and most non-emergency surgeries. And we want these posted right on their website. It's a very simple idea, but with very powerful consequences. Price transparency empowers patients. Fewer will delay care out of the fear of the unknown. It also lowers costs by bringing the power of the free market to healthcare. In states like New Hampshire and Colorado, we've already seen this approach work. Prices drop and patients save. And that matters for employers too. A Wisconsin Manufacturers and Commerce survey found that business owners rank healthcare affordability as the single most important issue for improving our state's business climate. Transparent pricing helps drive those insurance costs down. It frees up resources for business owners to raise wages or invest in their workforce. A study cited in President Trump's February 2025 executive order estimated that hospital price transparency could reduce costs for common services by up to 27%. We're talking real money, back in the pockets of families, workers, and business owners alike. And the public is with us too. 96% of Americans support price transparency. This is simply a dollars and cents bill. Price transparency saves real dollars, and it just makes sense. At this time, I will turn it over to Senate President, Senator Mary Felskowski.
Well, good morning, everyone. And today we're here to talk about Price Transparency for the Patients Act. Why are we doing this? Why? Why does Wisconsin need this? I have a question to every single person in this room and every person watching. What do you purchase? Major purchases that you have absolutely no idea what the price is. We as Americans shop for goods and services. If you're going to buy a new furniture, you're going to buy a new sofa. Do you shop at different stores for the best price? When you're buying a car, do you go online, compare your vehicles, find out what those costs are before you do a major purchase? But when you go to the doctor, you walk in, you have your service, you might need tests, you might need other things, you have zero idea what your costs are going to be. Absolutely no idea. And here's the other caveat to that. Try to find out. Try to call up your local provider and get a price estimate. They'll say, well, what insurance do you have? I don't want to know. I just want to know what your cash price is. They cannot and will not give it to you. I have been transferred to 3, 4, 5 different apartments when calling up to get the simple cost of a procedure, x-ray, or blood draw. You cannot find out. Why is that? And the bigger question is, why would providers oppose you knowing what a procedure is going to cost you? So what does this bill do? Little history on the bill and why we're doing this. In 2019, before leaving office, President Trump did an executive order that said hospitals had to put in machine-readable form their costs. In addition to that, they had to do their most common shoppable services. And what do we mean by a shoppable service? 80% of all care that we get is shoppable, meaning it's not an immediate, like an emergency room, or like I was in a car accident. I'm going to have a colonoscopy in 3 weeks. That's a shoppable service. I need to plan a knee replacement. I'm having shoulder surgery. I tore a tendon. Those are shoppable services because it's not an emergency and it's not happening right now. You have to have your most common shoppable services, 300, and a price locator, and it has to be on the front page of their website, easy to find, by insureds. Why is that important? When I sat down and looked and talked to one provider in my area, I'll use a mammogram as an example. The price varied between the different hospitals within that system, and dramatic price differential. This allows patients, because a lot of our patients today are on high deductible plans, some having as high as 10, if you're self-employed, $10,000 plus dollar deductibles. It's allowing you to take those dollars and it's allowing them to go much farther. In addition to that, we know in the state of Wisconsin that 80% of the insured lives on commercial insurance plans, employer-sponsored insurance, are self-insured, meaning the employers are the ones that are designing the networks, designing the care that they want to give. And I respect our employers in this state. They want the highest quality care for their patient or for their employees at the lowest cost. Well, they have no idea what that is. How do they know if they can't find out the prices up ahead of time? And why would we not want to give them that? What is so secret about not knowing prices? So in that 2019 executive order, President Trump was sued by the American Hospital Association to block this. Well, it finally went into effect in 2021. The problem is CMS, Centers for Medicaid Services, who was given the rule to enforce, is not enforcing it. And that's why, as Senator Bradley has said, other states have adopted the same legislation, taking states' rights back and doing the enforcement on their own. And that's what this bill is. What we are asking hospitals to do is exactly the same as what the federal government is. We're not adding any more burdensome regulation on them. But we are giving our Department of Health Services the ability to enforce when CMS does not. Just to give you a statistic, only 30% of the hospitals in Wisconsin are in full compliance with the federal order. 30%. And when you hear from your hospitals that this is a regulatory burden, it's too expensive for them to do, I want to point out one of our smallest critical care hospitals in Reedsburg, Wisconsin, is a hospital that's compliant. And they did it for $42,000. And that's a direct quote by the CEO of the hospital. It's not erroneous. It's not a burden. It's just the refusal to do so. And with that, I would like to turn it over to Representative Wittke.
Good morning, everyone, and welcome to the Assembly Parlor. I've agreed to be the Assembly lead author on this bill. This is my beginning my fourth term in office here, and I have a little bit different lens. I come out of private industry, and so I was sent here to solve problems. And so this is a new problem, a new issue that we're taking on this year. I've had plenty of conversations with individuals, businesses in my district. They're all concerned about high healthcare costs. They all want transparency into seeing how they can shift or improve costs for their employees as well as for their businesses. With that, there are huge challenges that exist in trying to move the needle on bringing down our high health costs. With that, I look to work with all stakeholders that are in this to come up with solutions that will benefit our citizens here in Wisconsin. With that, I look forward to this challenge and look forward to working with people that are going to try to solve the fact that we have some of the highest healthcare costs in the nation. And with that, I will turn it over to, which is a very important part of this press conference, which is people that are on the ground that actually deal with this. I want to introduce Dr. Nicole Hemkes to talk about the transparency and the impact on her patients. Thank you.
Thank you. I'm Dr. Nicole Hemkes. I'm the owner and medical director of Advocate MD here in Madison, Wisconsin. We are a direct primary care practice, so that means we provide affordable, transparent pricing on everything done within our practice, including labs, x-rays, medications we dispense. When I think of healthcare, I can't think of any other industry where you commit to having to pay for services, you have to sign a document before you will be treated, and without knowing what any of these services will cost. We have seen a shift in healthcare costs over the past couple decades. In our current healthcare environment, most patients are underinsured. That means that they have high deductible healthcare insurance policies that they are responsible for paying for all their out-of-pocket costs until they've hit their deductible. We not only need the information to be accessible to them, we need it to be digestible and easy to use, navigate, and understand. Unfortunately, healthcare cost and billing is not simple to understand. Part of this complexity is related to insurance billing, but also I believe some of the complexities of medical costs are designed to keep these charges hidden, intentionally complicated and very difficult for healthcare consumers to understand and navigate. I remember an experience 1 or 2 years ago of calling one of our local healthcare systems here in southern Wisconsin, and I had a list of 4 or 5 specific x-rays that I wanted to get the cash price for. I was doing this for our patients in order to figure out what would be the most competitive prices for them. After being transferred to 3 or 4 different people, multiple calls back and unreturned phone calls, I was told that they couldn't give me the cash price because they needed to run this through insurance. And I explained to them that they should know what they are charging for a service that they are doing at their hospital. And I was looking for a cash price, not an insurance price. So I wanted to dispel some other misconceptions about healthcare pricing. For many services performed in a hospital setting, the charge or price that they are submitting to the patient or to the insurance company is exponentially higher than the actual cost of performing this service. We see this with radiology, procedures, laboratory services, medication administration. The discrepancy in pricing can be staggering between different hospital systems within our state and also inpatient versus outpatient services. Some examples of this would be a laboratory cost that's $4 versus $400 for the same lab, an MRI that could cost $600 or $6,000, a surgery that might be $5,000 at one facility and $30,000 at another. There's no correlation between what a hospital is charging for that service or procedure and the quality that they are delivering. You could have higher prices being charged by a hospital for a particular surgery in which the surgeon is less skilled, performs less of these, versus a different hospital system where the surgeon is highly skilled and performs much more of that particular surgery. So many times you are actually getting more affordable services at a higher quality. So when we have a cost problem here in Wisconsin, this further exacerbates our access issue, which we already know that we have access problems with seeing a physician. So patients are actually avoiding going to the doctor. They're avoiding getting necessary medical services because they're scared of these costs. There's countless number of stories that we see in our clinic of patients that have avoided seeing specialists. Let's say for a cardiologist, they've avoided getting necessary tests done, again, because they don't know how much of that will be covered by their insurance or how much of that is their out-of-pocket cost. So they delay care. Sometimes they end up needing to go to an emergency department because of that delay of care, which of course is a much more expensive cost. So the current experience is that patients do not know the cost of these services until months later when they get their explanation of benefits from their insurance company. So this needs to change. Patients in Wisconsin deserve better care. They deserve access to this information so that they can be educated healthcare consumers. Thank you. And I'm going to introduce Steen Coleman.
Morning. My name is Steen Coleman. I'm the Chief Financial Officer for Paper Machinery Corporation. We're headquartered in Milwaukee, Wisconsin. We make the machines that make paper cups, paper containers. Our customers are located throughout the world in over 40 countries. We have roughly 150 employee owners actually, so we're 100% employee owned as well. Healthcare costs is one of the most significant expenses for our company. It's near and dear to my heart, obviously being the Chief Financial Officer. It grows year by year, 3 to 4 times the going rate of inflation, and we seem to have little or no control over it. I think we referenced that Wisconsin was one of the highest healthcare costs in the nation. I believe we're in the top 5 from what I've read. This is not good for current Wisconsin businesses. It's not good for prospective Wisconsin businesses, and it's certainly not good for the employees of those businesses. Our company became self-insured in 2024, hoping to better understand the drivers of healthcare costs so that we could implement measures to better control it and perhaps even reduce it. Getting more knowledgeable of the true cost of healthcare was not only surprising and alarming, but it angered us when you truly find out what the true cost of healthcare is versus what we're getting charged. Becoming self-insured makes both the employer and the employees consumers of healthcare. And like any good or service, a consumer needs to know the price and the quality of what they are purchasing in order to make the best decision for themselves and their families. Currently, healthcare is one of the only goods or service where you make the purchase and then find out the price. Would you walk into a car dealership and purchase a car without knowing the price? No, you wouldn't. For anyone who has undergone surgery in one of the hospital systems, you may not know the total price of that procedure for months, maybe even up to a year, after you've received several bills from different providers that you don't recognize. The only way that we will fix our healthcare system is to implement free market approaches where there is competition and where our prices are known upfront to the consumer. The prices should be easily accessible and include the total price of a procedure, including the surgeon's fees, the anesthesiologist's fees, the nursing fees, the cost of prescription drugs, the facility fees, the imaging fees, the lab fees, et cetera, et cetera. You never know what you're truly going to end up paying until all those bills have come in. This is true transparency. I'm here today speaking on behalf of employers and employees throughout the state that we support the legislation that requires pricing transparency in the healthcare system, and we need it now. Thank you. I'd like to introduce Thomas Carthauser with Mukwonago School District.
Thank you, Steen. My name is Tom Carthauser. I'm the Chief Financial Officer for the Mukwonago Area School District. We serve 4,800 students and have 700 employees in our school district in southern Waukesha County, and we are the largest employer in our 90 square mile that we encompass. Wisconsin is one of the 5 most expensive states in the United States for healthcare costs, and prices are continuing to rise each and every year. In my school district, health insurance has been the most volatile line item for decades. 2 years ago, when we were given our renewal rate to stay fully insured, we were given a 35% rate increase, which meant $2.5 million additional dollars just to maintain the status quo. In order for my school district to afford that, we would have had to close half of an elementary school and eliminate numerous positions just to keep our health plan in place at that time. That's unsustainable. I'm grateful for Senator Bradley, Senator Felskowski, and Representative Wittke for introducing this legislation. This bill represents an important tool for all of us, public and private employers, to manage costs. We know that there are significant variations for prices for the same healthcare services in Wisconsin, and this bill represents an opportunity for us to reward high-value healthcare providers in our state with more business. Price transparency is fundamental to free market healthcare, and I would like to see hospitals stop fighting this and to work with us to make price transparency a reality. There are no excuses that should stop this from happening. Healthcare is about the only thing that you purchase without knowing the cost, as others have said here earlier today. When the final bill comes in is when you know how much the cost of your healthcare was. And it's time for hospitals to show their prices so employers like my school district can steer our employees towards high-value healthcare providers. On behalf of the Mukwonago Area School District, I support this legislation. Thank you.
Thank you. So thank you to everybody for being here, and we'll take a couple of questions.
The Wisconsin Hospital Association released a report ahead of this that's saying that they're the most, or another report found that they're one of the most transparent in the country, even above states that have laws like this. So what do you have to say to that? Do you think that a law like this is actually going to help increase transparency if we're already doing better than these other states?
Yeah, we're doing better by their report than the other states, but we're not all the way there. We want all hospitals to have their prices up. And if you go through our bill, one of the most important pieces, in my opinion, is the fact that we specify where, right? So there's a whole bunch of places where you have to scroll and click through, and you'll eventually get to the prices, as is in the current executive order. But our bill specifies that it needs to be on the homepage, because if people are going to shop for prices, it should be uniform and it should be clear. This is how you get a price, and we want everybody to do it, not just do it better than some other states. We want to have full compliance.
I would add to that, and I'll challenge you all to go look at Reedsburg Hospital website. So what Senator Bradley is talking about is under the new executive order, you have to have it clear and on the homepage. Okay? So in order to find it on Reedsburg, you have to scroll all the way down to the bottom, where they have the fine print down there, like you see on most websites, where to contact us, where our address, different things, complaints. And the last little bullet point is price transparency. So we're asking it to be easy for clients to use. That's all we're asking for. And I would also say that according to Patients' Right Advocacy, which is very renowned, and they're following this nationwide. In fact, Patients' Rights is one of the top reasons they worked with the Trump administration to get this. Less than 30% of hospitals in Wisconsin are fully compliant. 30%. We have a long way to go.
And I have a follow-up question to that statistic. In that same report, it said that it found that no hospitals had been fined in Wisconsin for non-compliance. So, like, what is that discrepancy in, like?
That's why we're doing this. CMS is not doing their job. Plain and simple. And we think Wisconsin can do better. And I always believe that government closer to the people is the best. So if CMS is not going to do their job, CMS is a very large agency. There's 5,000 hospitals. This has not been a priority, especially under the Biden administration. So we're bringing that back to the state level, and we're going to make sure that it's a priority here at the state level because our patients deserve better. Medical bankruptcy is medical bills is the #1 cause of bankruptcy in the United States. Why? Why are we doing this? Doesn't make sense.
Last question.
So I've actually got a question about medical bills being high. So State Medicaid Director this week told me that the reconciliation bill coming down from the Trump administration is going to increase costs to the state by $8 million and potentially cause tens of thousands of people to lose coverage and increase costs for healthcare providers and people. Don't you think that should be a bigger concern about healthcare costs than increasing price transparency?
Absolutely not. No. Absolutely not. We are looking out for our owners, our business owners. You heard from the District of Mukwonago, $2.5 million to keep the same cost. They went self-insured to try to deal with that and redo everything. Think if they knew their costs up front. Think of that. We talk about teachers being underpaid. We need increase in wages in this state. All of these other things. Well, how can my businesses do that when they're paying this kind of health care? And they shouldn't have to. We can help them control their costs because we've seen it work greatly in other states, Colorado being the #1. They were the #1 to do this. Now let's take that $2.5 million and invest it back into our teachers and our schools and our kids.
Sure, but how will this help people if they're losing health care coverage?
We're not talking Medicaid as much here. We are talking fully insured. Okay? And from what our reports, I don't want to get into the big, beautiful bill. It's not even law. So, that's not even a reality yet. We're talking about what's going on in our state right now. Healthcare costs are driving our economy. WMC did a poll, a survey. 1 in 10 businesses in the state are looking at leaving the state to expand because of the cost of healthcare. It's a WMC survey, Wisconsin Manufacturers and Commerce. We talk about attracting new business. We need new jobs. We want to keep our young people here, our professionals here. Well, businesses aren't coming with these costs. We can do all the tax breaks and regulation, but when healthcare costs exceed everything else we're doing, businesses are going to look to a much friendlier state. And they are. When other states implement this and get a handle on their healthcare costs, we're in the weeds.
Thanks everyone for coming out. Again, like I mentioned at the beginning, senators and representatives have some other scheduling issues, but I'll be happy to answer any questions. Those offices will be happy to answer any questions. We just forward them on.
Wisconsin Eye, your unfiltered window into legislative deliberations and public policy programming, where our mission is to provide Wisconsinites an opportunity to access the legislative process and connect with conversations that inform our citizenry. Please consider supporting our mission, and thank you for watching. Wisconsin Eye, policy made public.